I forgot to turn on the recording. So we are excited about Doug Valerie from the Valerie Agency talking with us this afternoon about the transition to Medicare. Just a couple of quick housekeeping tips. We want you to ask questions. However, we'd like for you to do that in the chat. So open up your chat box, list your questions, and at the end, we're going to go through and answer those for you. And I believe that is it. So I am going to turn it over to Mr. Valerie.
Okay, and my name's Doug Valerie with Valerie Insurance Agency. Thank you so much. We will be using this handout, which I have in front of me. Hopefully you all have a copy of that printed out because it will help you take field notes or take a lot of notes. Because one thing I will say, I will give you a plethora of information today, just an absolutely ton of information. And there's no way you're going to remember even half of what I tell you or 10% of what I tell you because there's just a lot of information. And I'll say even that myself, I don't remember half the stuff I'm going to tell you because it's just a lot of information. You know, but one thing is, if you notice on this first page here, I'm Doug Valerie. Our telephone number is 1-800-330-8445. If you have follow-up questions, please don't hesitate to give us a call. This is what we're here for. Our job is to help you understand what is Medicare, when you sign up, what your timelines are, how it all works, what are your options, and then what's the pricing look like. That way, when you go, you're trying to budget right now, trying to figure out how am I going to do it. So our job is to make sure you understand how that all works. That way, it's not such a scary transition. As I tell most folks, you turn 65 or start Medicare once in a lifetime. I do it 20 to 30 times a day. So it's really not a big deal. But for you doing it one time, it's kind of a big deal. It's, you know, it's got that big dark cloud. It's like, what's going on? There's a lot of information out there, but when you don't have it in a manner where it's easy to understand, it's very confusing. So our job is to help it make it a little bit less confusing for you. Our email is info@valerieagency.com. That will go to our office, or my email directly is dougv@valerieagency.com. So you can ask us any questions that you have. All right, from here, I'm going to go to the next page. All right, and this, you see this second page here, we are all over the state of Florida putting on what used to be the Transition to Medicare workshops, where we physically would have a workshop, and you see that we do have a bunch of colleges that we do that for already. If we don't do it for your college, you could have your HR person reach out to us, and we can set up a time because our services are completely free to all the colleges. So we do this all over the state of Florida. All right, so from there, and of course now we've migrated to webinars due to COVID-19. So for the time being, we're going to handle webinars, but then once everything opens back up and they allow us to, we'll start also doing the physical workshops like we normally do. All right, so on this next page, you have the 4 parts to Medicare. All right, so on the top of this page, this is the original Medicare. So whenever you have anybody talking to you, and the terminology they're using is original Medicare, it's Part A, Part B. Part A is the hospital, Part B is the doctor. That's original Medicare. On the bottom of this page, that's the add-ons that they did. So they did those add-ons in the mid-2000s where they added the Part D drug plans. Right now, there's 27 different drug plans available. With the low-end price of less than $14 and the high-end price upwards to $165. Now, what we find is most people land on a plan right around $30 or less. You know, so usually it's right in that $30 or less zone when somebody's getting a Part D drug plan. On the left-hand side here, that's what we call your decision box. So if you have this handout and you have it printed out, you can write decision on the bottom of that box there, because within Medicare, that's where you're going to decide what direction do I want to go. Do I want to go with a Part C Medicare Advantage plan or the route of a Medicare Supplement plan? Quick question that somebody had was the drug plans per month was between $14 and $165 per month. It is correct, a per month cost for the drug plans. And again, most people land in a drug plan that's about $30 or less. So back to the decision box, you're going to decide whether or not you want to go with a Part C Medicare Advantage plan. Those are all network-based plans, or a Medicare Supplement plan. Those plans follow original Medicare. Now with original Medicare, there's no network. So that means no matter where you are around the country, you could basically see any doctor, any hospital you want. That is the best thing about Medicare. And the supplements were designed to be a secondary to original Medicare. So that's why in this box, the decision is, what direction do you want to go? You want to go with a network-based plan, or do you want to go with a non-network-based plan? And by the end of this workshop, this webinar, you should have a pretty good understanding of those options. So you're going to understand what direction you want to go. All right, from here, we'll go to the next slide. You got Medicare 2020. And notice at the top here, Medicare starts on the 1st of the month. So basically, and normally when you turn 65, Medicare is always going to start on the 1st of the month. It never starts on the 5th or the 15th or the 20th. It's always going to be the 1st of the month. So when would you start Medicare and when would you delay it? That breaks down to what I find is about 4 different scenarios. So we're going to go with scenario number 1. All right, scenario number 1 is I am 64 turning 65 and I'm already retired. I'm already retired. I'm 64 turning 65 and I have started Social Security. The key there is the fact that I started Social Security. Since I started Social Security already, the federal government is assuming I am already retired. So they will mail me my A and B card automatically 3.5 months prior to my effective date. So for a quick example, my birthday would be July 31st. If my birthday is July 31st, I'm eligible July 1st. That means 3 months prior to July 1st, 3.5 months, I'm going to receive my A and B card automatically. That's the only time I'm going to receive my card automatically, and it's because I started Social Security already. Now, why is it important to know that you're going to get that card automatically? Well, there's a couple things going on. One is you have people coming to your door. If you are 64 turning 65, you will be surprised the amount of people that will come to your door, even during COVID-19 when they're not even allowed to come to your door and talk to you. But Medicare rule is they are not allowed to come to your door without what's called a scope of appointment. That means they have to have an appointment written down with you and a form submitted to come to your door. If they just show up, they're already breaking Medicare rules. But I'll tell you, every day you're going to have people breaking those rules because that's what they do. Second thing that's going to happen is you're going to get phone calls, and you could be on the do not call list. If you're not on the do not call list, helpful tip, get on the do not call list. That way, at least if you get a phone call and you answer it and you define that somebody's calling you because of Medicare and you didn't ask for them to call you, you can let them know, hey, I'm on the do not call list. That's a $10,000 fine, and get them off the phone quick. All right, so then those two methods are really against the rules for them to reach out to you. The only legitimate way companies have to talk to you or reach out to you to tell you about their products is to mail you. So they're going to mail you stuff. It's going to start off sweet and innocent. 6 months out, 9 months out, you're going to get 1 or 2 pieces of mail a month talking about Medicare. And then it comes to 1 or 2 pieces a week. Then it's 1 or 2 pieces a day. Then it's 5 or 10 pieces a day. Then it's 20 to 30 pieces a day. It's overwhelming for a lot of folks. So you're going to be one of 2 folks. You're going to be the kind of person that's going to walk out to your mailbox with your garbage can and throw it all away. Or you'll be the other type of person where you're going to save everything. It's going to go into the corner or on a desk somewhere. So either way or either type of person you are, when you're 3.5 months out of your effective date, you'd want to really pay attention to your mail if you've already started Social Security and you're retired. Now, second scenario, I am retired. I'm 64 turning 65, but I delayed Social Security. I just didn't need it to start yet. I'm thinking I'm going to go ahead and do that later on, when I'm maybe 70 or something. So in that scenario, nothing's going to happen automatically. So if I don't sign up, I could face penalties. So with that scenario, I need to sign up within my 3-month window of my effective date. So again, my birthday is July 31st. That means my effective date's July 1st. I'm going to look at my calendar, go 3 months back. As soon as I have that 3 months back, I can now apply for Medicare. If I try to do it outside that 3-month window, notice you can't see my hand. They can't see it either. If you apply outside that 3-month window, they basically throw away that application. You got to do it inside that 3-month window. You can either call Social Security or Medicare, or if you're web savvy, just go to the Medicare.gov website, click on sign up. It will bring you over to the Social Security website to sign up. It takes about 10-15 minutes. It really doesn't take that long. Personally, I kind of like the online version because they will send you an email confirming that you've signed up, that they have at least received your application. So that's nice. Third scenario, I am 64 turning 65 and I'm still working. Okay, I'm still working and I'm thinking, you know, I'm probably gonna keep working. You know, I like what I'm doing. I enjoy my colleagues. I enjoy the kids. I mean, everybody's fun. So, you know, I might work for 2 or 3 more years. So what do I need to do? Well, technically, because you're working and you're on your insurance through your employer, and if your insurance is credible coverage, which you get that every year during open enrollment, when you sign up for your plan, there's some verbiage that talks about how your plan's credible coverage, then you don't need to do a thing. You don't need to sign up for Medicare. You don't have to do a thing at all. Now, what I tell folks though, just to make things easier later on, if you do not have an HSA plan, you're on a regular insurance plan, then you can turn on Part A. So you could do that within that 3-month window of turning 65. Just let them know you want to sign up for Part A only. And again, this is if you don't have an HSA account. All right, so if you don't have the HSA account, you can sign up for Part A. The reason why that's a good idea is for the fourth scenario, it will make things a little easier. Plus, you're going to get your Medicare number, and that's what's the most important thing. Because that Medicare number is no longer your Social Security number. It's now a variation of letters and numbers that's computer generated. So no one will know it until after you sign up for it. Now, the fourth scenario, I am now 66, 67, 68. Now I'm thinking, I'm tired. I don't want to do this anymore. My colleagues used to be fun. They used to be cool. Now they're annoying. I am not a big fan. And the kids that I used to like, I guess they're all gone because these new crops, I don't like them. So I'm out. I want to do something else now. Okay, now it's time for me to sit on my couch. It's time for me to go hiking. I want to go visit my grandkids. I want to go travel the world. I want to do anything but be here at work. So what do? First thing you're going to do is check in with your benefits department and find out from the point that you want to retire, what is your pay through date? Okay, so for example, if I'm going to retire at the, let's say middle of July, does my insurance run through July? You know, does it run through the next month? Is it paid up through that time period? Whenever you are going to start paying for it, that's when you want to get Part B to start. You know, so example, if I retire at the end of the year, I'm going to retire in December, does my insurance run through January or does it end in December? You know, so you can give them several scenarios to get a good understanding of it. But then once you know when you're going to start paying for it, then you're going to look back on your calendar 3 months, and that's when you want to apply for Part B. Now, how do you apply for Part B? There's 2 forms. The first form is the Part B application. In the Part B application, you're going to fill in your name and your address and all that stuff, your Medicare number, your Part A effective date, and then when you want Part B to start, you're going to put in on the remarks section. And the funny thing is, federal form that says when do you want Part B to start, the Part B application, there's nothing on the form on when do you want it to start. So you got to do it in the remarks section. Okay, the second form is the request for employment information form. In the request for employment information form, you're going to take that form to your benefits department. They're going to help you fill it out to prove that you continued to work and had credible coverage through your employer. With those two forms, you're then going to submit those to Social Security. Now, how do you get those forms? You can either call Social Security and they will snail mail you those forms. If you like, you could email me or give me a call and I can email you those forms. You know, because email's been around for only like, what, 40 years. So, you know, the federal government, not so savvy at it, but takes me 5 seconds to send you the email. You know, every year I pull those forms up, make sure I've got the latest ones. So you can always give our office a call. Everybody at the office has those forms. We can mail them out to you. Not a problem at all. All right, so now you got Medicare started. All right, so now you have Medicare started. What are your options? You have 4 options in front of you. Your first option is you're going to start Medicare and you can hang on to your employer plan. You have that option. Your second option is you're going to start Medicare and drop your employer plan and only have Medicare by itself. And that's pretty much what this page is right here. The third option is you would start Medicare, drop the employer plan, pick up a Medicare Advantage plan, that's Part C. And then the fourth option would be you can start Medicare, drop the employer plan, and then pick up a Medicare supplement, and then couple that with a Part D drug plan. So that's your 4 options. Now, the best way to understand those different options is really understand this second option here. So let's go over option 2 by itself as if that's the only thing you have. So again, you know it's going to start on the 1st of the month. Part A, then that's the hospital. Now, there's no premium for Part A. That's because all these years through payroll deductions, you have been paying for Part A. So if you ever notice your payroll stub, it's got that Medicare line item. That's what you're paying for, Part A. Now, interestingly enough, if you had never paid for Part A throughout your lifetime, when you went to start it, you'd have to pay for it. And if you paid for it each month, it'd be right around $425 a month. So it would be kind of expensive if you had not been paying for it all these years. So it was a pretty good idea that they went ahead and pulled that from your pay stubs throughout your lifetime. All right, now for Part A, there is a deductible and a copay. Just like with Part B, you've got a deductible, a copay, and what's called the excess charge. Now, the best thing about Medicare, I mentioned it earlier, but I'm going to mention it about a dozen more times at least throughout this webinar. The best thing about original Medicare, there's no network. That means no matter where you are around the country, you should be able to see a doctor, you're able to go to the hospital. That is by far the best thing about original Medicare. The downside though, because every option has a pro and a con. So the downside to Medicare would be the deductible and the copays. So for Part A, the deductible is $1,408. Now notice it's each admission, it's a per cause deductible. So that means for each time you have a new cause going to the doctor or going to the hospital and you're admitted to the hospital, you'd have to pay that deductible, $1,408. The copay is $352 per day. Now that one sounds worse than it is because they don't charge the copay till after the 61st day of being admitted to the hospital, meaning you're in the hospital for 2 whole months before they start charging that copay. You know, where the deductible, you know, you can go to be admitted to the hospital several times, and if it's for a new cause, you could be paying that deductible several times. So that one's probably the more scary out of the 2 for the Part A. For Part B, all right, now there is a premium for Part B. If you notice here at the bottom of the page, the base premium is $144.60. That's the least somebody will pay. That's what most people wind up paying. But if you notice, if you made a lot of money, so let's say if you're married and you filed jointly between you and your spouse, you earned somewhere around $200,000, then your Part B premium would be the $202.40. So what happens after you receive your Medicare card, usually it's a couple weeks afterwards, you will get a new letter from Social Security indicating what your Part B premium is. And what they're doing is they're looking 2 years back at your tax return. All right, so for Part B, just like Part A, there's no network. So you can go anywhere you want. The downside, the deductible, $198 calendar year. That's not that bad. I wish I only had a $198 deductible. With my plan, my deductible is like $7,000, you know, so $198, I'd be like, woohoo. All right, now the downside though, here's the big down one, 20%, 20% coinsurance. Now what that means is whatever Medicare approves, you would be paying 20% of it. So for example, Medicare, you go to the doctor, you do a little procedure, doctor bills Medicare. Medicare says, even though the doctor billed $500, Medicare says, no, the code says it's valued at $100. Because just like any insurance company, they have negotiated rates, they have set rates. Medicare is the same way. They have negotiated rates, they have set rates. They say, nope, it's valued at $100. That means Medicare is going to pay 80%, $80. You're going to pay 20%, $20. Now, scale that up as high as you want to go. You had open heart surgery. Medicare approved $100,000. That means Medicare is going to pay $80,000. You're going to pay $20,000. There's no out-of-pocket maximum when it comes to original Medicare. That is a downside. Then there's this third gap here called the excess charge. The excess charge is the extra 15% that a doctor can charge over and above the Medicare approved amount. And the excess charge is in relation to assignment. I don't know if you ever heard that term before, assignment. If the doctor accepts assignment, they accept Medicare rates. If they don't accept assignment, then they can charge that excess of 15% above the Medicare approved amount. So go back to that first example. Doctor charges $500. They accept assignment. Medicare says it's valued at $100, but now they don't accept assignment. That's now $115. So it's $15 above the total amount. So that means Medicare is going to pay 80%, $80. I'm going to pay the 20%, $20, plus the 15%, $15. So I paid a total of $35 for that example. We go all the way up to, I had open heart surgery, Medicare approved $100,000. Now I paid $35,000 for that. So if you did not have this gap covered, any doctor you saw, you would want to ask them, do you accept assignment? Because that would be a very important question to be asking to know in advance what they might be billing you. Okay, from there we can go to the next page. And if you have any questions, you can always chat out those questions. Really enjoy any questions because it does help me then take a sip of water and wet the whistle, which I'm going to do now. Thank you. All right, so on this next slide, Medicare options. So on the left-hand side, again, that would be your option 2, original Medicare by itself, option 2. So if you've got this handout printed out, you can write up here on the top, option 2, Medicare Parts A and B, and again, all doctors and hospitals. There's no network when you're talking about original Medicare. Okay, quick question is review assignment again. Assignment is when a doctor accepts assignment, they accept Medicare rates. So if the doctor bills $500, but Medicare says whatever they did, whatever procedure it was, the code they used was $100, if the doctor accepts assignment, they accept $100. If the doctor does not accept assignment, they still take Medicare, they just can charge an extra 15%. So if you go to like Shands, Mayo, Moffitt, you know, off the top of my head, I know they don't take the assignment. So they can charge that extra 15%. You know, if you go to a specialty doctor, you know, a lot of them don't take assignment. Usually your regular internist, your regular doctor that you see, your general doctor, they usually take assignment. That's the specialty ones that we see a lot of the times don't take assignment. All right, great question. If I get Part A and keep working, would it be primary or secondary to my group insurance? It would be secondary. So your group insurance while you're working is your primary insurance. And you turn 65 and then I start Part A, your group insurance is primary and your secondary would be Part A. It may or may not do a thing for you. You know, because it just depends on your deductibles and your copays with your group plan. But again, you're eligible for it. there's no charge, so you might as well go ahead and get it started. If it happened to save you $50, it saved you $50. Great. But what the biggest thing is, when you do decide to retire, it does make things a little quicker and a little easier for you to get Part B started and then get your other insurance set up. So it helps reduce that stress level later on. Great question. Great question. All right, down the middle here, you've got Medicare Advantage, HMO, PPO. On the top here, that's your third option, option 3. So you could write option 3. And you could also write Part C, because Medicare Advantage is Part C. Part C is Medicare Advantage. With those, you see it's a limited network of doctors and hospitals. It's going to be an HMO, a PPO, a PFFS, a POS. There's about 10 different acronyms that all mean networks. The biggest two that folks know is HMO. HMO is a health maintenance organization. That's where you have in-network pricing only. Normally, if you get out of the network, you're on your own. You're going to pay 100% of whatever you're doing. A PPO is a preferred provider organization. Well, the way those generally work is you're going to have in-network pricing, which is much better than out-of-network pricing, but you have the ability to go out of the network. You're just going to pay 2 to 3 times more as a copay and your out-of-pocket maximum. So people tend to try to stay in the network, but it does give you some flexibility. The way the Medicare Advantage plans work, they start off with a service area. So your service area, now I'm just going to pick a county here. I'm going to say Marion County. All right, so let's say you live in Marion County and you pick a plan that's in Marion County. That's their service area. So that means I can really only see doctors and hospitals inside of Marion County. If I step outside, then I could be paying 100% of all my services, or I'm paying out-of-network pricing. I'd have to go back in my county to be able to see somebody within my network. The service area could be several counties around me. It could be Central Florida. It could be the state of Florida. It could be a nationwide plan. So if you're looking at the Medicare Advantage plans, your first question is always going to be, what's the service area? That's a very, very important question, because you don't want to get stuck visiting some friends out of the service area, not feeling good if you're on a trip, and then only being able to go into the emergency room. And it has to be coded emergency for it to work, but it would still be covered as an emergency. But if you just went to a doctor out of the network, out of your service area, you'd be paying your out-of-network pricing, whatever that would be. All right, and then on the right-hand side, you have the fourth option, option 4. So if you got this printed out, you could write option 4 in the top right corner. Medicare Supplements, they were designed to be a secondary to Medicare. So Medicare is the primary and the supplement would be secondary. And you notice that says all doctors and hospitals again. And that's because the Medicare supplement would follow original Medicare. The way those work is, let's say I go to the doctor. The doctor is going to bill Medicare. Then Medicare will do what's called a crossover in the background and send the bill over to the insurance company. So when it comes to the Medicare supplements, it does not matter who the insurance company is. It could be company ABC, NBC, CBS, XYZ, doesn't matter which company it is, because the doctor and the hospital, they're not billing the insurance company. They're only billing Medicare, and then Medicare sends that over and tells them who to pay, how much to pay, and all they do is they write checks. So with the supplement, there is zero decision-making skills with the insurance carrier. They cannot make any decisions. They're told by Medicare who to pay and how much to pay. So that's that big difference between option 3 and option 4, is with the Advantage plans, those are all network-based plans, and the supplements follow Medicare. All right, so the question is, so the supplement picks up the remaining balance. What they do is they're designed to pick up those different deductibles and copays. So I'm going to flip up. So remember these deductibles and the copays, depending upon the supplement you pick. Like let's say you were old enough and you qualify for the plan F as in Frank, that plan paid the Part A deductible and the copay, the Part B deductible, copay, and excess charge. So that plan paid everything. So that means if you went to the doctor or the hospital, anything that's Medicare approved, You walked in, you walked out, and never took out your wallet for a checkbook or a credit card or nothing. You never gave them cash, and you didn't get bills either. So if you had to get a knee replacement and you had that plan, you didn't pay a dime. So you could see the best doctors and not pay a dime. And every insurance company is the exact same way. Once they say, I'm going to offer a particular plan, they cannot deviate from the benefits of that plan. So it's exactly the same plan. So that you're going to understand that in a second too. I just turned 64 in April. Do I need to turn on Part A before I turn 65? If you're still working, you do not need to turn on Part A before turning 65. You can do it really at any time. There's no penalty if you're still working. Even if you're not working and you're retired and it's just Part A, well, you really would have wanted to if you were retired. So I take that part back. But if you're still working, you did not need to start it. And if you have an HSA account, you don't want to start it because Medicare will stop you from being eligible to participate in an HSA. So you don't want to start Medicare if you're on an HSA account. But if you have regular insurance, then you can turn on Part A. And again, that's something that I recommend people to do to get your Medicare number. And again, that makes it easier for that fourth scenario when you do go to retire later on in life. All right, so on this next slide, we're going to go in a little bit more detail between your third option and your fourth option. On the left-hand, on the left-hand side, there we go. On the left-hand side, we have Part C, Medicare Advantage. And again, that's your third option. That's option 3. So if you have this printed out, write option 3 up here. On the top right-hand corner, the Medigap, traditional Medicare supplement, that's your fourth option. So you want to write option 4. So going down the left-hand side, Part C, Medicare Advantage, you've got the Medicare, let's say, choice of doctors and hospitals, limited choice of doctors and hospitals. You may need a referral depending upon the plan. Doctors may drop the plan without notice. Hospitals may drop the plan without notice. And we do these workshops all over the state of Florida. And I tell you what, especially when we do the face-to-face workshops, we get a lot of feedback from folks. And we've been told time and time again that somebody had a Medicare Advantage plan, they had a procedure set up. The doctor, everybody was in the network. But then 6 weeks after the procedure was done, which worked out great, everybody did a fantastic job, but 6 weeks after the procedure, they got a bill, and that bill was out of network. And that's because the doctor or the facility fell off the network prior to them doing the actual procedure. So I would recommend, if you go the route of the Advantage plan, take 5 minutes, make a phone call, write down the name, the number, and the time and date of whoever you talk to, and verify that everybody that's working with you for that procedure that day or the next day is still in the network. And I'm going to go a step further. Even with your employer plans, that's a network-based plan. Whenever you have a network-based plan, it does not hurt to take 5 minutes. Verify that you are still in the network, especially the anesthesiologist. A lot of times they're on different networks. So even though your doctor's in your network and the facility might be in the network, the anesthesiologist is somewhere else. They're on a different network. So then you're going to get a bill out of network with them. So you want to verify just, whoever the team is, everybody's in the network. That way you're not going to get a surprise. Last thing you want to do is get a surprise of a really, really high bill when you're not expecting it. That's not a fun day. We don't like fun, non-fun days. All right, with those plans, they could have deductibles, copays, out-of-pocket costs. The out-of-pocket costs for a Medicare Advantage plan will range from about $1,800 on the low end to about $10,000 on the high end. It just depends on the plan that you pick. We see the average somewhere in the $4,700 to $6,700 is what a lot of them have. Now, Part B premium. Now, here's a plus, because like I always say, every option, there's a pro and a con. The con for the Part C Advantage plans would be the networks by far. That's definitely the con. The pro is that they can be very, very inexpensive. They can have a very low monthly premium. Some of them will have a no monthly premium. Some of them will pay you to be on the plan. Can you imagine signing up for a health insurance plan and they're going to pay you to be on that plan? Wow, that sounds great. But the way that plan's going to wind up working, the way most of those are going to work is, what do you think happens to that service area? That service area shrinks down. So if the plan is either a super low premium or it's a no premium or they're paying you, generally that's where that service area just shrunk down. You know, if you never go out of your service area, you never go out of your county, you know, and the doctor that you know, the one doctor you see is in it, it's probably not going to be bad for you, you know, but you really want to understand what the limitations are. That way there's no surprises. And that's really the big thing. You don't want surprises. Okay. Now, takes over Medicare. With the Medicare Advantage plans, they take over Medicare. That means all the claims are being paid through the insurance company. And what basically happens is, and this is also why those premiums can be really low or why they're paying you to be on the plan. When you sign up for a Medicare Advantage plan, the federal government is basically paying off that insurance company. On average, they're getting approximately $10,000 per person, you know, for the year. So they basically get handed a bucket of money when you sign up for them, and then Medicare washes their hands of you. You no longer have original Medicare, you have a Medicare Advantage plan, and you're going to go by those rules. So all the claims are paid by the insurance company, not by original Medicare. Those are also annual plans. They start January 1st and they end December 31st. Even if you start your plan in October, it's going to end December 31st and then start up again January 1st. So everything about the plan could change. So every year you get a very thick book. It's, you know, nice thick book and really tall, a lot of reading. And if you have any insomnia problems, those things are a great cure. All right, and then down here, you have limited opportunities to change the plan. So the times to change the plans would be the annual open enrollment time, which is from October 15th through December 7th. And then you have another time period, which is January 1st through March 31st. Those are the two time periods that you can make changes. So if you had a doctor's appointment for a little procedure set up for, let's say, April or May, and then you find out that they no longer take your plan, you either postpone it or pick a new doctor in a new facility. And then in that next year during open enrollment, make a change and get back into a plan that they take. On the right-hand side, you've got the Medicare supplements, the traditional Medicare supplements and the Medigaps, making sure I'm okay on time. Again, all doctors, all hospitals. It follows original Medicare. With those plans, they pay the different deductibles, copays, and out-of-pockets, those different out-of-pockets that Medicare has. Again, it depends on the plan, which we're going to get into in a second. Original Medicare pays first, the supplement pays second. It's the secondary to the Medicare. Okay, question. Is Medigap also called Plan D? No. Plan D is the Part D drug plan. Those are separate plans altogether. Right now, there's 27 different drug plans. We're going to talk about those in just a moment. The Medicare supplements are lifetime plans. So that means when you sign up for a Medicare supplement, you can keep it for life. They are guaranteed renewable every January 1st. So you don't have to do anything with the Medicare supplement once you've signed up for it. It just stays on. They cannot kick you off that plan for any reason besides failure to pay the premium. That's the only way they're allowed to kick you off the plan. Otherwise, you can stay in that plan until you're 150 years old. Then they might go, wow. All right, then the bottom right-hand corner, you see change plans at any time. If you don't mind filling out insurance applications, I know I've got, 18 people on this right now, so one of you probably enjoys filling out insurance applications. So if you do, you could actually every month throughout the year fill out an application and change the plan. There's no open enrollment time when it comes to original Medicare. All right, well, not really a question, but a statement. They're basically saying, sounds like the supplement is the better way to go. The supplement does give you a lot of flexibility. It really does give you a lot of flexibility. There is a higher cost up front for the supplement, but it then protects you on the back end, where the Advantage plans, you could be cheaper on the front end, but then pay a lot more on the back end. But yeah, good statement. And that's why we teach you. The question again here is, why wouldn't you select the Medigap plan? Well, a lot of folks will go with the Medicare Advantage plans because, again, if it's a zero premium, they're looking at that, you know, or they're paying you to be on it. There was a great ad last year with, and now I'm going to lose his name, football player, passer, lost his name. You know, as we get older, brain and stuff that's in the brain just kind of just leaks out. I don't know what's just gone. I had a name and it's gone. But there was a great commercial where a quarterback, and I can't remember his name now, but Miami Dolphins, I think. But he was Joe. No, Namath. Joe Namath. There we go. Hey. Takes me a little while to work my way through it. But yep, thank you. So Joe Namath was doing a great ad. And what's interesting is when he's talking about it, he says some words that people wouldn't recognize. One is, it opened up in his area. All right, so key phrase there is that it was now available in his area. So that plan was an Advantage plan that had a service area, but that plan gave him $50 worth of drug stuff at a drugstore, like over-the-counter creams and whatever, and vitamins and such. So it gave him little perks. You know, maybe they added some vision, maybe a little bit of dental in there. You know, it's really like one dentist that's over there, but still, you got some dental. So they gave you a little bit of perks. So a lot of folks will go to those plans because of those perks. The downside is when you go to use it, as in, I need a knee replacement, or, you know, I got really sick and now I've got to see a doctor that's a specialty doctor, they may not be in the plan. So that's the trade-off. And that's one of the reasons why we do these workshops, these webinars, to teach you what these differences are. That way you're happy with the decision that you make. That's key. You got to be happy with the decision that you make. All right, now on the next slide here, this is the chart that the government makes for the Medicare supplements. So I'm going to go over the different plans for the Medicare supplements because those are standardized. The Advantage plans are not standardized. Just depends on where you are, your zip code, how they work, what their premiums are. So again, they could be where they pay you. They could be a zero premium. They could have a very low premium, or they could even have a really high premium. It just depends very much on those, where these supplements are standardized. So I can kind of go over those better for you in this platform. All right, so now the best way to read this chart, and this is a standard chart. If you get this chart from any insurance company, it's going to look pretty much the same way. Plan F, if you look down the middle of this chart, that is going to be the best way to understand how to read it. Going down that column, Plan F, you see basic. Basic's at the top of the page where it's talking about the Part A coinsurance. So this first box is taking care of the Part A coinsurance and the Part B coinsurance. Then two more boxes down, the Part A deductible, another box down, the Part B deductible, and another box down, the Part B excess charge. So that plan, I'm going to scoot up again, that plan just took care of all 5 of those gaps. So anybody that went on that plan with any insurance company, it works the same way. The only difference with any insurance company is going to be the premium, which we're going to get into premiums in a second, but they can be all over the board, all over the board. All right, so now that Plan F, as some of you may have heard, has gone away. So I like to tell you how great something is, and then I like to just take it away from you. So apparently somebody in a waiting room got really upset because all these people kept coming in and going and not paying for anything. And they got really upset and they wrote their congressman. Congress listened and said, you know, you're right. That's not fair that you're sitting there having to pay copays and all these people don't have to pay anything. So they got rid of it. Sort of. I like to be clear. So the way it works is if you turned 65 starting January 2nd of this year, you are no longer eligible for the Plan F. If you have already turned 65 prior, so anytime prior to this year, you're still eligible for the Plan F. You could still get it. Even if Okay, so again, so this is the Medicare supplement chart, and these are the different plans that are available. The Plan F for the Medicare supplements pays all of the deductibles, co-pays, and excess charges. So if somebody has that Plan F, it would pay for everything that's Medicare approved. So again, that Plan F would follow Medicare. These are the Medicare supplements. So that means Medicare would get the bill and then send it over to the carrier and tell the carrier they got to pay all these things. And if you had the Plan F, you don't pay anything. But anybody that's turning 65 this year and after, you're no longer eligible for the Plan F. Let's say somebody is right now 66 or 67, they continued to work, they delayed Medicare, they can start Part B, they're still eligible for the Plan F because they've already turned 65 prior to January 1st of this year. All right, so now the best plan somebody would be able to get this year, it would be Plan G as in George. So that, if you notice, the first box looks just like the Plan F first box. So basic is your Part A coinsurance and the Part B coinsurance. Two more boxes down, the Part A deductible. But then notice right here, the Part B deductible box is empty. So that means the Plan G does not cover the Part B deductible. Right now, the Part B deductible is only $198. So again, not a really big deal for the difference. And really these days, yes, you need to get more alphabet letters. Medicare loves letters. I don't know why. They're a big fan of letters. And people confuse the letters all the time because they have a Plan C, which is different from Part C. So that's just horrible. So anyway, back to this chart. So going down the line, you notice if the box is empty, it's not coverage. So every box means coverage. Now let's go all the way to the right-hand side of this page. Plan N is in Nancy. All right, so the question was $198 per month, but I don't know what the $198 per month would be because I haven't talked premiums yet. Oh, $198 is the deductible, calendar year deductible for Medicare. So just like your group plan, if you have $1,000 deductible, calendar year deductible, if you go to the doctor, you're going to pay something towards the deductible till you meet the deductible. Then once you met the deductible, then you'd pay whatever your copays are. With this, if you had the Plan G, you'd pay up to the $198. Once you've done that, you're done. It pays all the rest of the copays and everything else for both Part A and Part B. And yes, you would still need a drug plan because as you hear, this only pays the deductibles and the copays for Part A and Part B, the hospital and the doctor. Great questions. And yeah, it's a lot of information. So that's why we always suggest don't hesitate to give us a call or email us with any other questions that you have. We also have the transition to Medicare videos on our website that you can watch to kind of just watch them as often as you want. The password to watch those is Valerie, V-A-L-E-R-Y. All right, so going to the right-hand side, Plan N as in Nancy. If you notice, the first box covers the Part A deductible, but then you're just going to pay a copay of $20 for the doctor and a $50 copay at the ER. Thank you. Two more boxes down, it does cover the Part A deductible. But then notice here, the Part B deductible box is empty and the Part B excess box is empty. That means if somebody went with the Plan N as a Nancy, they would want to verify with any doctor they saw, do you accept assignment? That would be a very important question for that person. Now the Plan N cost versus like the Plan F saves you about $50 a month. So it's a pretty good cost difference. So somebody that doesn't see the doctor very often, that's not a bad deal for you. Okay, and then so basically if you see the box is empty, there's no coverage. And then some of these plans like Plan K, you see there's a difference of 50%. Plan L, it's covering 75%. So all the boxes just mean different coverage levels. But the best one that you can get into today would be the Plan G. That gives you the most coverage all around the country. It doesn't matter if you're in California, New York, Florida, anywhere. the Plan G is the same Plan G. Even if you moved, the Plan G is the same Plan G, can move with you. All right, on the next page here, we're going to get into some premium prices to get you an understanding of how that works. I'm going to use the zip code 344 because it does get zip code specific. The way insurance companies set their premiums, they set their premiums within a zip code, and what they do is for most of them, they have 3 areas. They go with a low area, a middle area, and a high area. And what I mean by that is they take the claims that they have in certain zip codes and the claims that they have that are the same, that are kind of low, they'll be in this low area over here. So they group all those together. Then the other zip codes that have higher claims, they may be the middle area. So they're going to have higher premiums in that middle area. Then you have an area that's really a lot of claims. There's just a ton of claims. And those zip codes are going to have the high premiums. So you got a low premium area, a middle premium area, and a high premium area. For most of the state of Florida, you're going to be in the low and the middle. If you are in South Florida, like Palm Beach, Broward, Miami, that's the high area. So premiums will, like from this zone here, if you look at age 65, look at Plan G from 172 to 236. That high area would start somewhere in that 250 range. It's much, much higher down there in Palm Beach and Broward than it is in really the rest of the state. You know, the rest of the state, you're in the middle area and the low area, which generally is between the $10 to $15 difference. So it's not a big difference in that low to middle area. So looking at this, the other thing that they do is they take women and men, they charge them differently. All right, now this is where it gets interesting. At least I'm a geek about this, so I think it's interesting. Ladies, for all the ladies that are on this webinar, all your life, you have cost more. When it comes to health insurance, they've always charged ladies more and men less. But then when you turn 65, it flips. Women are now cheaper, men are more expensive. So guys, when you turn 65, be on your best behavior because you know you're on thin ice, you're costing her more money. So be careful. All right. So when you're looking at this chart here, Plan G at age 65, if you were in the zip code of 344, blah, blah, the least premium you're going to find is right around 172. That would be for the ladies. Men would be closer to 178 to 180, right around in that zone, close to $8 to $10 more, depending upon the carrier. All right. Now, one thing that we're showing here is carriers that accept payment through Florida retirement system. I'm going to explain in a second why that's pretty important. I know some of the colleges are within the Florida retirement system, some are not. So if you are, there's an extra perk for you, which is really nice. I'll explain that in a moment. So as you see here, plans at age 65, Plan G, 172, all the way up to 236. And I can easily find you a Plan G in that zip code way higher than $236. It's just for the carriers that we have, that's their zone right there. Okay, all your colleges are within the Florida retirement system. Perfect. I thought there was a couple that weren't, but perfect, excellent, great. So then you all will get that perk. Then it would just depend on if you're in the pension plan or the investment plan. All right, so if you notice here, Plan F, $200, Plan G, 172 on that low end. My way of thinking has been if you are 66 or 67, you're still qualified for that Plan F, run the numbers first before just assuming you want to jump into that Plan F. If you can find, or we can find that Plan F for at least $30 cheaper, the Plan G, $30 cheaper than Plan F, then you're doing really good going with that Plan G. Because remember, the only thing the Plan G does not cover is the Part B deductible, $198. So if you're saving almost $350 a year in premium, you're doing better going with the Plan G, the lesser plan, than the Plan F. Some carriers I'm seeing having a higher rate increase when it comes to the Plan F. We just saw one earlier today where a carrier went up about 15% on the Plan F, but they didn't have a rate increase on the Plan G. So kind of looking at that and the way they're working things, you know, you may be safer with that Plan G if you're saving a good $20 to $30 a month. All right, now notice here too, plans at age 66 to 69. So let's say you start your plan at age, and you start Plan G at age 65, and you're paying $172. A lot of folks will look at this page and say, okay, so now I turned 66. I had a birthday. You're going to say, happy birthday, I have a rate increase. No, that's not how it works. In the state of Florida, we are a save age state, otherwise known as an entry age state. What that means is whatever age you are when you start the supplement, you're going to stay the age that you started. So if I start age 65, I will always stay age 65, and I'll always pay the rate of a 65-year-old. So now, does that mean I'm never going to have a rate increase? No, that's not what I'm saying. But whatever the 65-year-olds are paying, no matter how old I get, I'm paying that same rate. So for example, let's say a lady calls me up. She lives in zip code 344, blah, blah. She's 81 years old. She says, Doug, I'm looking at the Plan G. I'm 81 years old. I'd say, okay, for Plan G, you're looking at 275 up to somewhere in that 330 range. Same Plan G, I'd go with the 275. There's no reason to overpay when you don't need to. But if that same lady had been in that Plan G already, since age 65, she'd only be paying the 172. So whatever you are, whatever age you are, when you enter the supplement, you would stay that age for as long as you keep that plan with that carrier, okay? Also, I'm going to kind of go back to the beginning. Remember, you had 4 options in front of you. Your first option was you could start Medicare and hang on to your group plan. Remember that your group plan, and that, you know, you could actually stay on your group plan forever. You actually have that option because part of the being part of the state employee system, the Florida law says the public employer must allow their retirees the same benefits as their employees. The only caveat is you're going to pay the monthly premium, the whole thing. Your premium could be $600 a month. It could be $700 a month. It could be $800 a month. That would be a secondary to Medicare. So remember that if you did choose that first option, you're going to pay the $144.60 at least, plus $600 a month, $700, $800, whatever your actual premium is for your plan. And Medicare has no network, but your group plan still does. It still has the deductible, still has all the copays, still has your out-of-pocket max. Or you did like the fourth option here, go with the Plan G, 172. The only out-of-pocket you have is $198 for the doctor. You know, so not too bad when you're looking at that comparison. Okay, now on the next thing, and also down here, just as a reminder, because we're doing this and this is statewide, you can always give us a call, give us your zip code. We're asking you for your zip code, your gender, if we can't tell, your age, you know, so your date of birth. With that information, we can give you a list. Here's a bunch of carriers, here's their premiums. You know, that way you get a good idea. This carrier, this one, and this one. Right now, we have 3 that we can pay through the Florida retirement system. Why is that important? Well, because one of the neat things you get working within the Florida retirement system is you get a subsidy. It's a health insurance subsidy. Okay. Health insurance subsidy. All right, so with the health insurance subsidy, what that does is you're going to get a credit of $5 for every year of credible service. So that means if I work 30 years within the Florida retirement system, I'm going to get $150. It's 5 times 30. That's the max. I'll get $150 added to my pension. So for example, let's say prior to that, I'm going to get my pension. My pension's $1,000 a month. They're going to add the $150 to that. So now my pension's $1,150. You know, so they will add that money to it. The key that you have to remember is that is prior to drop. So that money that you're getting, that $5 for every year of credible service, is prior to drop. So if I work 30 years within the Florida retirement system and 5 of those years was in drop, then it's going to be 25 times 5. All right, but that money is still used for your health insurance. That's the whole point of that money, is to help you pay for your insurance. The only thing is when they set it up, they taxed it. They weren't supposed to tax it. It was never meant to be taxed. So the way you get around it, and that's where this first cartoon is, you have the Florida retirement system direct deposit your entire pension into your checking account. You're not very happy. Why? Because Uncle Sam just taxed all of that money, including your subsidy money. What you want to do is pick an insurance carrier that you can pay directly from the Florida retirement system to the carrier. You don't get constructive receipt of the money. So that means if you have the Florida retirement system send the money directly to the insurance company, you're a happy camper, and Uncle Sam is kicking in the dirt because now the subsidy money is tax-free. Tax-free money is always better money, always better money. All right, so you see, I got, if I get Part A when I turn 60, all right, I've got a question, so I'm going to take a sip. Okay, so here's that's a great question. So if I get Part A when I turn 65, do I need to wait until retirement to get Part B and get the supplement? You don't have to wait. We have a number of people that are still working that went ahead and started Part A, started Part B, picked up the supplement and the drug plan because that was actually a better option for them. And that's where you have to play with the numbers. If your college in particular is paying 100% of your insurance, very seldom do I see that work out for somebody. Because if the employer is paying 100% of your premium, it's hard to get much cheaper than that unless you know you're going to have a procedure. And let's say your out-of-pocket is up high. If your deductible is like a $3,000 or $4,000 deductible, or maybe your out-of-pocket maximum is $6,000 or something like that, well then, yeah, you know, getting Medicare, the supplement, the drug plan could be a lot cheaper for you. So it just depends specifically on the person whether or not that would work for them. What I do, I like to keep things simple. I take a blank sheet of paper, I draw a line down the middle. On the left side, this is what your cost would be with your group plan. On the right side, what it would cost for Medicare. On the bottom, whatever the total is cheaper, whatever the number is lower, that's what I would do. If it's cheaper for you to stay put with the group plan, you do that. If it's cheaper for you to go on to Medicare, you do that. We can always work the numbers with you because you never want to overpay when you don't need to. But you can start Medicare while you're still working. You just don't have to. You know, and again, for most people, it's monetarily, it's better for you to stay put with the group plan usually. All right, good. All right, next slide. Great questions, great questions. Love the questions, keep them going. All right, so this last slide here, or second to last slide, we're gonna talk about the drug plans. All right, so right now there's 10 different drug plans, 27 different companies. So that means, or there's 10, said that backwards. There's 27 different plans with 10 different companies. That means there's 27 different formularies. What's a formulary? A formulary is where that's the list of prescriptions that are covered under that particular plan. And every one of these plans has a different formulary, so they will tier the drugs differently. All right. So that means if I have one drug, that one drug on one plan could be tiered as a tier 1 low cost generic. Same drug on a different plan could be tiered as a tier 2 non-preferred generic. Same drug, different plan could be a tier 3 preferred brand. Same drug, different plan could be a tier 4 non-preferred brand. So it looks like there's no rhyme or reason. And whenever I have somebody on video, I can see them shaking their head. Yeah, I see you shaking your head. All right. So a lot of folks are thinking, oh my gosh, that is really confusing. Why would they do that to us? Well, think of it this way. You go to the grocery store, you go to Publix, Winn-Dixie, Walmart, Walgreens, CVS, you go to any store and they have a flyer, all right, eggs, 30 cents this week. So you're going to go into the store to get that lost leader. That's what that flyer is all about, the BOGOs. They're just to get you in the store. So what these companies do is they take a higher tier drug and they're drop them down to a lower tier. That's why you're seeing a particular drug in all those different tiers and the different plans, because they're adjusting them to try to drive business into that plan. All right. So they all do that. That's why one of the things that we do for all of our clients is we'll take a list of your prescriptions, the dosages, how often you take them per day, which pharmacy you're willing to go to, and then we'll plug them all in, look at all 27 different plans, and let you know which one will work best. We've signed up with a lot of the carriers, so we can sign you up for most of them. But I had a guy earlier today that I got him signed up with something else, but gave him the telephone number for the plan that was right for him. Because again, it's what's right for him. You know, save money where you need to save money. All right, so how do these plans work? There's 4 phases. The first phase is the deductible phase. That's where the max deductible that any plan can have is $435. Not all plans have the deductible. Some do, some don't. But if it does have the deductible of $435, then that is a calendar year deductible. So if you have 5 prescriptions, and let's say they're all brand name drugs, and you're picking up your drugs, and each one of them has a negotiated rate of $100, then you would pay $100 for the first drug, $100 for the second drug, $100 for the third, $100 for the fourth. You're up to $400 now. That 5th drug, you'd pay $35 for, and now you've met that deductible. All right, then you'd enter into the next phase, the copay phase. So in the copay phase, every drug plan gives you the drug account, which is $4,020. And what they do is they deduct the full negotiated rate of the drug from that drug account. So again, using those 5 brand name drugs, each having a negotiated rate of $100, when I pick them up, they're going to deduct $100 for each one of those. I might pay a $10 copay, but they're going to deduct $100 from that drug account of $4,020. And they're going to keep doing that until that drug account depletes to 0. If that drug account depletes to 0, I would then move into the next phase, which is the coverage gap or donut hole phase. That's where you're going to pay 25% for brands, 25% for generics. So now that $100 drug, I'm going to pay $25 when I'm in the donut hole for each one of those. And I'm going to do that until I hit my troop cost of $6,350. Yeah, fun. And then once that happens, I'd move into the final phase, the catastrophic phase, where I'd then pay 5% for the drug cost. So now that $100 drug, I'm paying $5. All right, now I'm going to back up because I said a term that you may not have ever heard before. I said TROOP, T-R-O-O-P. So this is a term that Medicare created, which I think is horrible because it's very confusing. True out-of-pocket costs is what they're saying is your cost, but it's not. You're not spending $6,350. So I'm going to bottom line this for you. In the copay phase, for you to actually get through the copay phase, you'd have to spend somewhere around $1,800 or so to get through that phase out of your wallet. To get through the donut hole, you'd have to spend another roughly $1,800 out of your wallet to get through the donut hole before you get to the catastrophic side. Then you're paying 5% of the drug costs. So I will say this, a lot of folks these days don't actually get into the donut hole. The reason is there's a lot of generics out there these days. Every year you should be talking with your doctor and verifying the drugs that you take. Is there a generic alternative? There are $4 lists out there. Walmart has a $4 list. Target has a $4 list, CVS. Winn-Dixie. Winn-Dixie's got a $4 list. Publix, I think, has a $7.50 list. And then there's also some free drugs out there. If you take lisinopril, metformin, amlodipine, those are all free at Publix and Winn-Dixie. They also have a list of antibiotics that are free. So check your drugs to see if you can get them for free. And then tell them you don't want to use your drug plan. I want to pay cash. If you go to the doctor and they're going to write you a script for an antibiotic, ask them, hey, can I use one of the free ones at Publix or Winn-Dixie? They write you the script, you walk in there, you walk out of there without paying a dime. That might be the only time you walk in and out of a store and not buy anything else because you just don't feel good. All right. So there's lots of ways of saving money now. Also, GoodRx. If you've ever used that before, sometimes you can get really good deals with using GoodRx. So definitely try using that too. So there's lots of little things out there these days that you can do to save money. Because if you can get a generic, always try using a generic first. It could really seriously save you a lot of money. Because paying a tier 1 copay for most of these plans that have that deductible phase, if it's a tier 1, they don't even charge you the actual drug cost. They charge you zero. They start off with a zero copay for a lot of those plans. Okay, good question here. What about all right, some words I cannot pronounce, but what if a drug costs $50,000 or plus per year? If you're taking a drug that costs, $50,000, and again, that's something that you're getting from the pharmacy, If let's say you've got cancer and you're getting chemotherapy, you're getting something done at the facility, that's generally covered under Part B of Medicare. So that means if you had the Plan G, and if you had not paid the deductible yet, you'd pay the $198, then it's all taken care of because it's done at the facility. But if you're picking up a drug at a pharmacy and that drug was, your $50,000 plus per year, then you would basically go through all this stuff and paying 5%. But normally when something costs that much, you can work with the manufacturer. And there's also groups out there that you can work with that they will help give you grants to help you pay that money. Okay, so another question is, I'm retiring in the middle of the year. Do I have to sign up by December 7th before I qualify when I leave employment? When you leave employment, you are a special election period. It's called an SEP. So this December 11th or December 7th doesn't mean anything to you. Everything you see on TV ads and people calling you up don't mean anything to you. If you're still working, you're over 65, whenever you retire, you're in your own timeline. So basically you have to sign up for Part B within 8 months of leaving employment. So you have plenty of time to sign up. So like we deal with a lot of school districts where somebody retires in June, but they might not start Part B until October. That's fine. You're well within that 8-month period of time. So don't worry about the December 7th time period, the open enrollment time period. It has nothing to do with you. That is for somebody that's already on Medicare and they're redoing things. That's the open enrollment time to make changes for somebody that's already on Medicare. If you maybe started in January of this year or June of this year, then that time period is the time that you'd make the changes. So great question. All right, and again, down here at the bottom, the annual open enrollment time is October 15th through December 7th. And that means for these drug plans, you can change them every year. We always tell all of our folks to, drop us a line, get in touch with us prior to October 15th. That way we can get your list. And then during the open enrollment time is when we can go through that for you and then let you know what our findings are. So we'll look at your plan, compare that against all the other plans for the following year during that time period. And if it's right for you to make a change, make a change. If not, we tell you, stay put, you're not going to do any better. So we could do that homework for you if you like. The surcharge, just like the Part B premium, if you made a lot of money, I will always say, great job for making a lot of money. Federal government will charge you more. So if you earned filing jointly $200,000 between you and your spouse, they would charge you an extra $12.50 on top of your monthly premium. Remember, the Part D premiums range from about $14 all the way up to about $165 this year. Okay, and I think that's all there. And the last page here, as a quick review, top of the page, Medicare Part A. No premium again for Part A. All these years you've been paying your payroll deductions, so there's no premium for Part A. For Part B, the base premium is $144.60. If you have this page printed out, next to the $144.60, write SS. You're going to be paying Social Security that $144.60. If you have Social Security started, they will just automatically deduct it from your Social Security check. If you have delayed Social Security, then they will bill you quarterly. They're going to mail you a quarterly bill. It will tell you the months that it's for, so you're going to see a nice big bill. And if it's going to be a while before you start Social Security, you can do something that's called Medicare Easy Pay, where they can just deduct it from your bank statement or bank account. So they basically just draft your bank every month if you want to do it that way to keep your budgeting easier. Some folks have a problem with doing a quarterly bill with their budgets. So that works out for them. And then in the middle here, if you went with the Medicare supplement, the plan G for the ladies, 172. Doesn't really matter which one it is and what that number would be, but next to that number there, if you write FRS, Florida Retirement System, whatever you do there, you want to pay through the Florida Retirement System if you're getting that subsidy money, because if you're getting that subsidy money, you want to keep it tax-free, because that's the equivalent of taking that premium and knocking it down some because of the tax savings, which is a really good thing. So you want to pay that through the Florida Retirement System. For the Part D drug plans, as we say, the average we're going to say is about $30. So when you're budgeting, that's a good safe number as you're trying to figure out the numbers on how much everything's going to cost you. So next to the 30, again, you could write SS. Most people pay that through their Social Security deduction if they have Social Security started. Otherwise, they could pay that as an EFT through the bank. A lot of folks do the coupon book, where they just write a check each month or one for the entire year. And then some carriers will allow you to pay through a credit card. If you do it that way, use one that gets points. Points are good. So we can always help you with your timelines and the process. We can help insure your spouse. Again, the Medicare supplements are guaranteed issue, especially when you start Part B or turn 65, they're guaranteed issue. All carriers, all plans are guaranteed issue for 6 months. The Medicare Advantage plans are guaranteed issue. You want to use your subsidy, that FRS subsidy, because you want to do that tax-free. And you notice that Plan G did have foreign travel emergency built into it. So that's a nice little perk. And again, we're a broker, so we do shop around for you. So if you want, you could use us if you like, or just, ping our brain a little bit to get some more information. Again, that's what we're here for. We're here to make sure you understand all your options, how it all works, your timelines. We've got a very good track record so far that anybody that's contacted us has never had to deal with a penalty with the federal government, because we will keep track of you and make sure that you do things on time. So thank you so much for, I already got a question here. What is guaranteed issue? All right, guaranteed issue is with the Medicare supplements. When you turn 65 or start Part B, they're guaranteed issue, meaning there's no health questions, and they are guaranteed issue for the first 6 months. So it means any application you sign up for or fill out, there's no health questions for 6 months. After that 6-month period of time, you can change plans any month, but you would have to answer health questions to do so. And they can deny you after that 6-month period of time. So for example, somebody had A and B and they continue to work, because I get that sometimes. They then retire, they're not guaranteed issue because they've been on A and B for some time. They would have to answer health questions to be able to get into a Medicare supplement. Hang on, I'm reading the question. That one's a little longer. To determine income-based surcharge for... Oh, yes, okay, so how do they determine the surcharge or what your premium is for Medicare Part B? what they're going to do is look back at 2 years. So this year, they're looking at your 2018 tax return. So that's what they do, is they go back 2 years at your tax return. And whatever your tax return says you earned, they tell you, and then they're going to tell you what your premium is and if there's a surcharge. And also, they just go by the previous 2 years. So for 2018 or 2020, they're looking at 2018. In 2021, they're going to look at 2019. 2022, they're going to look at 2020. So it just follows like that. If you are retiring now and you see that your income is really going to be dropping a lot with retirement, you can give them a call, and there's a form that you can fill in to have them look at your current year's taxes. So I've had folks that have done that, and they have gotten that premium reduced to their rate, because it is a rolling number. So if you retire now and you've been working really a lot and your income was way up here, but then it's stepping down as you're retired, that number will drop down to the base premium if you bring it down there. All right, I'm gonna take a sip for that one. Okay, oh, that's an interesting question. Okay, so I've got somebody that says their husband had deceased and that they're receiving their FRS retirement, including that subsidy. So that subsidy would be taxed because you are getting that direct deposited into your checking account. But since your employer is paying 100%, really there's not much you can do about it, except, well, no, there's really not much you can do about it. Just say your insurance is free because your employer is paying for it. If you got to pay the extra taxes there, you're going to pay the extra taxes there. When you do retire, then you can change things over because you could actually pay through that retirement fund. So just what you'd want to do, though, is verify that retirement fund, the FRS pension that you're getting, how long does it last? Because there's, I think there's 4 options there. Where one of them is only like 10 years, one of them goes for life. So you'd want to just verify before you set it up to pay through that way. But that's a really good, interesting question though. Oh, here's a question. How do I charge my customers? I don't charge anything. Just like this webinar didn't cost the colleges anything, didn't cost the AFC anything. My services, our services don't cost you anything. So then people go, well, how does it get paid? Well, how do I afford all these books? So the way I can afford all these books is with a green screen. The way I afford all those books is we get paid directly from the different insurance carriers. So again, the way we work, we're going to give you, here's this plan, this plan, this plan, this carrier, their premium. You tell me which one you want to do. We can then set you up with that carrier. They will pay us a commission directly. So you don't pay us a dime for our work. If you don't go through us, I do recommend go through a broker, because that's how we all work. Brokers, the way we all are set up is we are beholden to you, the client, where if you call an insurance carrier directly, they are beholden to themselves, to their company. So that's the biggest difference, is go through a broker. And we're a broker, but you can go through anybody if you like. For life regards, oh, that's okay. So you're answering the question of for life, regardless if I marry again. Oh, that's great. So then, yeah, if you are going to get that FRS pension for life, when you do retire, then you can pay your insurance premiums directly from that pension. That way, that subsidy money would start becoming tax-free once you've retired. So that's a great way. All right, great question there too. All right, that was just another one following up on the pension. All right, so that is our workshop. That's our webinar. Again, really appreciate you all coming out to this webinar. Hope you didn't have to drive too far. Hope you didn't get rained on. But thank you very much. Again, if you come up with any questions, don't hesitate to reach out to us. Send me an email, give us a call. Again, our services don't cost you anything. We're here to give you all the information you want. Thank you again so much.
Doug, will you tell them again about the videos that you have on your website?
Oh, yeah.
I think that will be helpful for a lot of people. I know I plan to watch them so I can talk to my mom about her. I was trying to pay attention and hear this for my mom.
Yeah, you can go to our website. Our website is valerieagency.com. So it's www.valerieagency.com. And then on the bottom right-hand corner of the home page, there's a link where it says the transition to Medicare videos. Because fun thing is, with COVID-19, I was in the middle of driving all over the state of Florida, putting on our workshops, and then everything got canceled. So then we scrambled because like, well, how are we going to let people know what they're doing? So I, created some videos. I built an extra website, and we were able to put the videos on the website. So when you click on that link, it's going to ask you for a password. The password is Valerie, all in lowercase, Valery. And then when you get to that website, it's going to have 6 icons for the 6 different videos. They last between 2 minutes and 7 minutes. I think the drug plan one's probably the longest one because that's by far the most confusing thing about Medicare. But for each video, you got to plug in the password. That way we could get that out there and get it done and stay within the Medicare rules. So only folks that we invite to it can go to it. So you all are welcome to go to that website, click on the Transition to Medicare videos in the bottom right-hand corner, plug in Valerie, and then that will bring you into the site. Then for each icon, each video, just plug in Valerie again, Valery, lowercase, and you can watch the videos as often as you want. Hopefully they help you.
Great, great. Well, listen, thank you so much, Doug. You have just provided a wealth of information. It's a lot.
It is a lot.
It's a lot. And
I did not lie in the beginning when I said I'm going to give you a plethora of information.
you did not, but you really do a great job of explaining it in a way that that anybody can understand it. It's a complicated a complicated process here of selecting from the various plans, but I have not heard anybody explain it as simply as you have. So that is definitely a gift. Thank you.
Thank you.
Thank you, everybody, for participating. Hopefully we can get Doug back and we will do something else with him. It might even be that we tackle Medicare again and maybe just focus on one plan or something. We'll talk about it and see what we can do. But thank you, Doug. Thank you.
You are so welcome. And we can always do this webinar again if you like. Just let me know.
Okay, we will definitely do that. All right, everybody, have a great day. Stay dry if you can. Bye-bye.